Hello again. This is chapter 27, Measuring Vital Signs. This is a fun chapter. Remember how you study and taking notes and reading and reviewing. Make sure you know your key terms and key abbreviations and know the skills. We are going to go past the contents and go straight to the chapter. Vital signs, the four vital signs of the body functions are temperature, pulse, respirations, and blood pressure. Vital signs reflect the function of three body processes essential for life: regulation of body temperature, breathing, and heart function. Vital signs are often called TPR, temperature, pulse, and respiration, and blood pressure. Some centers include pain as a vital sign also. Vital signs are measured to detect changes in normal body function, tell about responses to treatment. It often signals life-threatening events are part of the assessment step in the nursing process. A person's vital signs vary within certain limits. They are affected by sleep, activity, eating, the weather, noise, exercise, medications, anger, fear, anxiety, pain, and illness. Vital signs. Vital signs are measured during physical exams when the person is admitted to the nursing center, as often as required by the person's condition, before and after surgery, before and after complex procedures and diagnostic tests, after some care measures such as ambulation, after a fall or other injury, when drugs affect the respiratory or circulatory system, when there are complaints of pain, dizziness, lightheadedness, shortness of breath, rapid heart rate, or not feeling well, and also as stated per care plan. Vital signs are often measured after ambulation. Vital signs are usually taken daily and weekly in the nursing centers, and vital signs show even minor changes in a person's condition. Vital signs. Accuracy is essential when you measure, record, and report vital signs. Unless otherwise ordered, take vital signs when the person is lying or sitting. The person is at rest when vital signs are measured. Report the following at once: any vital sign that has changed from a prior measurement, vital signs above the normal range, vital signs below the normal range. If you cannot measure vital signs, tell the nurse immediately, right away. If unsure of your measurements, promptly ask the nurse to take them again. That's all you have to do. And you can also ask another co-worker to check behind you too. Vital signs are recorded in the person's medical record. If measured often, a flow sheet is used. The doctor or nurse compares current and previous measurements. Now, let's go back a little bit. When I say you can ask another co-worker, if that person's sitting up, breathing and talking and what have you, that's fine to ask another co-worker to check behind you, okay? If that person is not awake and look unconscious or whatever, you get that nurse, okay? Body temperature. Body temperature is the amount of heat in the body. Thermometers are used to measure temperature. It is measured using the Fahrenheit and centigrade scales. Temperature sites are the mouth, rectal, axilla, tympanic means ear, membrane, and temporal artery. Fever means an elevated body temperature. You always have a temperature. It's just either elevated or it's low, but you always have a temperature of your body because that means you're alive. When you say, I have a temperature, yes, you have a temperature. But what is it? Is it high? Is it 100? Is it 96? So that's when you need to say, I have to check my body temperature so that you find out if it's high or if it's low. Always report temperatures that are above or below the normal range. Heat is produced as cells use food for energy. Heat is lost through the skin, breathing, urine, and feces. Older persons have lower body temperatures than younger persons. An old temperature of 98.6 Fahrenheit might signal fever in an older person, because usually their temperature is, when you get older, 70 and more, it's usually like 96.8. And so, as you can see, it kind of reversed around from 98.6 to 96.8. And that's why it can be a fever for an elderly person. And that's why you need to take vital signs, so you can know that person's norm. Types of thermometers. Glass thermometers have been eliminated from the healthcare settings. Electronic thermometers, some have oil and rectal probes. Tympanic membrane thermometers, temporal artery thermometers. Digital thermometers, disposable oil thermometers, and thermometer sensitive tape. So glass thermometers take a long time to register, and of course they easily break, and of course we don't use them anymore. But they're still around. The person may bite down and break an oil thermometer and be injured from it. They pose an environmental hazard because of mercury. Those are your types of thermometers. Starting from the left, you have the mercury thermometer. Then you have digital rectal thermometers with shelf covers. And then you have an electronic thermometer, digital thermometer to the far right top, tympanic membrane thermometer, disposable or thermometer with chemical dots that changes color with the body heat, and sensitive tape. You have a temporal artery thermometer and touchless digital thermometer. Now everything, the bottom right, is the only thermometer now that's being used because of the COVID virus. Okay? So because they don't want to touch you, so all the rest of them are all obsolete now. That quickly. Using a tympanic thermometer, number A, you see where the person, when using a thermometer, membrane thermometer on an adult, the ear is pulled up. As you can see, the arrow going up, and you pull back gently. The probe is inserted into the ear canal so it can read. Now, this is for children. This is not in here, but this is for children in case you have children and you have to take their temperature. For who may have children, nieces or nephews, the ear is pulled down and back, and the probe is inserted into the ear canal. And just think of children being down, toddlers or what have you. Well, the adult is up, they are height, okay? So that's how you would know the difference of going up or down. Pulse. A pulse is felt every time the heart beats. The pulse is the beat of the heart, felt at an artery as a wave of blood passes through the artery. Pulse sites, you have the temporal, carotid, radial, femoral, popliteal, posterior tibia, and dorsalis pedis, the pedal, which is at your foot. Pulses on each side of the body. The radial pulse is used most often. The carotid pulse is taken during CPR and other emergencies. The apical pulse is felt over the heart. This pulse is taken with a stethoscope. You can take a radial pulse without disturbing or exposing the person. You can see figure 27 in edition 8 in the textbook for pulse sites. Pulses are on each side of the body. The apex, apical, of the heart is at the tip of the heart. It means at the bottom of the heart, just below the left nipple. The stethoscope is an instrument used to listen to the sounds produced by the heart, lungs, and other body organs. It is used to take apical pulses and blood pressure. Here you have your pulse sites, artery pulse points. And you see the temporal artery, carotid artery, your brachial artery, radial, your femoral artery, popliteal, your posterior tibial artery, which is right there at the bottom leg, on the inner side, and your dorsalis pedis artery. So those are the sites. Taking a radial pulse, as you can see, the fingers are just slightly on the inside of the wrist. And you just gently press down. You don't want to do it hard because you can cut it off, cut the pulse off. This is parts of a stethoscope. You see the ear tips are there, ear tube, tubing, the veil, chest piece. The diaphragm is the round, more round part in the stem. You see that. Using a stethoscope. To use a stethoscope, wipe the air pieces and diaphragm with the antibiotic wipes before and after use. Place the earpiece tips in your ears. Place the diaphragm over the artery to prevent noise. The pulse rate is the number of heartbeats a pulse felt in 1 minute. The rate varies for each age. The adult pulse rate is between 60 and 100 beats per minute. Report abnormal pulses to the nurse at once. Tachycardia pulse rate greater than 100 beats per minute, and bradycardia pulse rate is less than 60 beats per minute. A radical or apical pulses are taken on persons who have irregular heart rhythms, take drugs that affect the heart. Now the radial artery is on the thumb side of the wrist. Count the pulse for 30 seconds or then divide by 2. If the pulse is irregular, count it for 1 minute. In some agencies, all radial pulses are taken for 1 minute, and I agree with that. They all should be taken for 1 minute. Rhythm and force. The rhythm of the pulse should be regular. An irregular pulse occurs when the beats are not evenly spaced or beats are skipped. Force relates to pulse strength. A forceful pulse is described as a strong, full, and bounding. Hard to feel pulses are described as weak, thready, and feeble. You must count pulses accurately. You must report and record the pulse rate accurately. And taking them for 1 minute. The apical and radial pulse. The apical pulse is on the left side of the chest, slightly below the nipple. It is taken with a stethoscope. Count the apical pulse for 1 minute, no less. Count each lub-dub as 1 beat. The apical pulse and the radial pulses should be equal. To see if the apical and the radial pulses are equal, 2 Steph members are needed. The pulse deficit is the difference between the apical and the radial pulse rates. Taking the apical and the radial pulses at the same time is called the apical radial pulse. And apical pulses are taken on persons who have heart disease, have irregular heart rates, and rhythm, and take drugs that affect the heart. You take like digoxin, that person's heart rate will be low, should be low, and it can be, and the nurse has to know what it is. And I always check the pulse anyway before you give a certain medication like digoxin, because your pulse rate changes and you don't want to give it if it's below 60. So that's just a little information. Location of the apical radial pulse, as you can see, there's the sternum, the heart, and apical pulse is right below the heart tip. Each respiration involves 1 inhalation and 1 exhalation. Heart and respiratory disease usually increase the respiratory rate. Respiration means breathing air into inhalation and out of exhalation, the lungs. Oxygen enters the lungs during inhalation. Carbon dioxide leaves the lungs during exhalation. The chest rises during inhalation and falls during exhalation. The healthy adult has 12 to 20 respirations per minute. Each respiration involves one inhalation and one exhalation. Heart and respiratory disease usually increase the respiratory rate. As hint, hint. Remember, anytime you hear something 2 or 3 times, you know you need to know that information. Respirations are normally quiet, effortless, and regular. Both sides of the chest rise and fall equally. If they're not doing that equally, you can call the nurse. Count respirations when the person is at rest. Count respirations right after taking a pulse. Keep your fingers or stethoscope over the pulse site. To count respirations, check the chest rise and fall. People tend to change their breathing habits when they know their respirations are being counted. Therefore, do not tell the person that you are counting them. Count respirations for 30 seconds, multiply by 2 for the number of respirations in 1 minute. If you know the abnormal pattern, count the respirations for 1 minute. In nursing centers, respirations may be counted for one minute. Follow the center policies on everything. Blood pressure, BP, is the amount of force exerted against the walls of an artery by the blood. Blood pressure is controlled by the force of heart contractions, the amount of blood pumped with each heartbeat, how easily the blood flows from the blood vessels. Blood pressure equipment. As you can see, there are different kinds. You have the manual in A, and B is another manual. C is a machine, and D is by a machine. It'll pump it up for you, okay? Which is an automatic vital sign machine. Blood pressure. Systolic is the period of heart muscle contraction. Diastolic is the period of the muscle or the heart muscle relaxation. Blood pressure is measured in millimeters mm of mercury, Hg. The systolic pressure is recorded over the diastolic pressure. You'll have the systolic number, the line is under it, and then the diastolic pressure number goes right up under that. You measure systolic and diastolic pressures. The systolic pressure is the pressure in the arteries when the heart contracts. It is the higher pressure. The diastolic pressure is the pressure in the arteries when the heart is at rest. It is the lower pressure. A systolic pressure of 120 millimeters of mercury and a diastolic pressure of 80 millimeters of mercury is written as 120 over 80 millimeters of mercury. Blood pressure has normal ranges. Systolic pressure is less than 120, and diastolic pressure is less than 80 milliliter of mercury. Hypertension, blood pressure measurements that remain above systolic pressure of 140 or a diastolic pressure of 90. Hypotension, low tension, when the systolic blood pressure is below 90 and the diastolic pressure is below 60. Blood pressure, the stethoscope and a sphygmomanometer are used to measure blood pressure. Blood pressure is normally measured in the bradycardia. You use a stethoscope and a sphygmomanometer to measure blood pressure. The sphygmomanometer has a cuff and a measuring device. There are Android, mercury, and electronic types. Blood pressure is measured as the cuff is deflated. Measuring blood pressure, you see in A, that's the cuff. You see in B, where they are filling for the brachial pulse. And if you notice, the cuff is above the elbow. It should always be above the elbow. And in C, they show where you place the stethoscope diaphragm, right above, right over the brachial pulse. The area is used for correct cuff alignment, as you can see. Blood pressure. Some people normally have low blood pressure. Older persons are at risk for orthostatic hypotension. However, low hypotension, low blood pressure, can signal a life-threatening problem. Review the contents in box 27.2 in the textbook. Blood pressure can change from minute to minute. Report any systolic measurement at or above 120. Also report a diastolic pressure at or above 80. This is hypertension. High. Report a systolic blood pressure below 90. Also report a diastolic pressure above 60. This is hypotension. Low blood pressure. This is a charting sample of how you would write out the vital signs. You see the date is 10/19, time is 7 a.m. Their weight is 126, temp 98.4, pulse 72, respiration 20, blood pressure 142/84, and you put your signature and your titles. Wouldn't the title be CNA or SRNA or NA? Quality of life. You must protect the right to privacy when measuring vital signs. Always keep resident information confidential. You don't have to repeat what you've heard, like when you take the blood pressure or the pulse. You don't have to say it out loud. Vital signs are just as private as other information. Do not share the information with family, visitors, and roommates unless that client's residents say it's okay. Then you can probably do it, but I would ask the nurse first. The right to personal choice is important. Expose the person only to the extent needed when taking auxiliary or rectal temperatures, apical and apical reticle pulses. Unless directed otherwise, vital signs are measured with the person sitting or lying down. Let the person choose the position. This is the end of measuring vital signs.